We have these patients come in initially every month until we get to know them as a patient and we get to know that they've got a history of compliance. All right? We don't, now once they have been compliant, and it takes anywhere from 6 months to a year, we trust them, we know the issues and there's no problems there, then they have to come in every 3 months, all right, for their prescriptions. We give them only 1 month at a time with dated prescriptions, all right. This last thing is we always check what's called a cures report. And that's essentially in our state, cures, the Department of Justice puts out a little paper you go online for, and it prints out every scheduled drug that this person has got for the last year. And we check that every visit they come in. Number one, to make sure they're not double dipping or getting it from somebody else. Number two is that they're they're filling it, all right? And we demand for our scheduled drugs, they have to go to our pharmacy that we pick. They don't have a choice. All other medicines, they go anywhere they want. But for the scheduled drugs, we have one pharmacy. And how we pick that pharmacy, it's a good pharmacy, they have good prices and all that kind of stuff. But we have a very good relationship with the pharmacist there. And if the pharmacist suspects a problem, he calls us right away, all right? We like that because it gives another level of support if there's issues, if this patient's getting in trouble or is he diverting or there's issues there. So we mandate our patients on their drug contract that they sign, that they have to go to our pharmacy, all right? And very seldom we break that. Once in a while, if there's some insurance issues, we'll change that. But we want them to go to our pharmacy. And that's stated right on their drug contract. Every patient signs a drug contract. Essentially, they can't get any narcotics from anyone else, things like that. If they had a patient 2 days ago that came in that wanted a different narcotic, and she wanted to change from, she's doing better with their pain management, and she wanted to change to, from Norco to Tramadol, which we support. But we had her bring in all her old prescriptions, her unfilled prescriptions for that medicine, all right? And if we change before the end of the month, we make them bring their bottle in, right? And we dispose of those extra narcotics. But that's how we keep it even and not getting in trouble. A lot of doctors are scared of the DEA and the Department of Justice and the Medical Board. The DEA is not out to give doctors a hard time. That said, there are certain things that need to be done to prevent or give the best chance of not getting in trouble for patients and dying.